Good morning, my name is Roberta Andreola and I'm here to ask you a question. Have you ever wondered how we went from having to cut off infected limbs in the shortest span of time possible to electronic implants or prostheses? This is just one of the answers given by Dr. David Schneider, a board-certified orthopedic surgeon, in his book, The Invention of Surgery, A History of Modern Medicine, from the Renaissance to the Implant Revolution. As you can probably guess from the book's title, in just 21 chapters, Dr. Schneider moves through centuries of history, highlighting and describing the greatest inventions that made medicine what it is today. To present each step in the evolution of medicine, Dr. Schneider enriches his storytelling by adding stories from his younger times, from when he was a medical student up until he was an intern. Personally, I really like this detail because as a medical student myself, it gave a perspective on what the future holds in a medical degree, and also it made the reader feel closer to the author. This last perception was also brought on by the fact that the author makes puns or directly references the reader. This technique made the reading of the book really easy, making it comprehensible to every potential reader, and making hard topics, like for example brain implants or the birth of antibiotics, seem like a piece of cake. Anything one man can imagine, other men can make real, said Jules Verne. And I think that it perfectly sums up what Dr. Schneider expresses in The Invention of Surgery. In fact, throughout the book, we can see a deep connection between scientists from all over the world and their ideas. An example could be the use of chemical gases as anesthetics, a topic that is treated in Chapter 9, that found a fight between various American physicians and dentists over who thought of it first. And this fight actually ended with the tragic suicide of Horace Wells, who just 2 weeks after his suicide was recognized to be the first one to use nitrous oxide as an anesthetic. Another aspect we can derive by reading this book is the connection between medicine and every great discovery from the last 6 centuries. In fact, taking the same example as before, we know that scientists started to test chemical gases as anesthetics because of their growing usage in the Industrial Revolution. But going back a few centuries and a few chapters, in Chapter 2, we see also how the invention of printing press was useful in medical knowledge. In fact, with the invention of printing press, medical knowledge could be more diffused since more books were made. Also, one last example is the dye industry, which is a chemistry-based field, and how it helped with the invention of antibiotics. In fact, certain bacteria used to attach to certain dye, and so scientists started to understand how to manipulate both artificial and natural chemicals to terminate disease-bringing bacteria. A peculiar fact that the book brings out is the deep connection between medicine and personal relationships. From John Hunter, who was the last successful surgeon to operate without anesthesia, and his brother William, who was a keen anatomist, up to Joseph Lister, who made breakthrough discoveries about gangrene and what caused it, also thanks to his wife, Dr. Schneider makes it pretty clear that many of the inventions in the history of medicine could not have been made without the personal relationships of its main characters. One last example is William Halsted, the father of modern American surgery, who is also the first one to develop surgical room gloves, and this is thanks to his soon-to-be wife, who was a nurse that developed a skin condition on her hands due to the harsh chemicals used in the surgical rooms. Nonetheless, the invention of surgical room gloves is seen as one of the single greatest advances in the history of sterile technique. Towards the end of the book, after bringing up and explaining a variety of topics, going from the birth of the current American health insurance system to the birth of sports medicine, Dr. Schneider brings the topic to a more philosophical level, talking about the future of medicine and surgery, and also imagining a future where man will be part cyborg, or as he likes to call it, Homo electris. Personally, I'm not sure if the author was exaggerating or not when he said that we'll all be part cyborg, but as Jules Verne said, anything one man can imagine,